The federal government has been urged to rise against the increasing brain drain in the health sector by implementing outstanding agreements to motivate health workers. This came to the fore at the end of a two-day quarterly meeting of the Senior Staff Association of Nigerian Universities, Teaching Hospitals, Research Institutes, and associated institutions held at the Obafemi Awolowo University Teaching Hospital, Ile-Ife. Rafiu Hamid has more, and after that, business news.
It's the closing of the quarterly meeting of Senior Staff Association of Universities, Teaching Hospitals, Research Institutes, and associated institutions. The event provides platform for delegates who had converged on this auditorium in Ile-Ife, the opportunity to deliberate on issues affecting the union and Nigeria at large. The union is not happy that the World Health Organization ranked Nigeria's health sector as 163 out of 191 in the global rating.
Over the years, we have always frowned at medical tourism.
Presenting the communique, Comrade Ken Bassi described the act of medical tourism by Nigerian leaders as a factor discouraging the progress of the country's health sector.
Council notes with dismay the rate at which health workers, especially professionals, are migrating out of the country for greener pasture, which is called the Japa syndrome. It is sad to reveal that most of our health institutions are under deteriorating conditions. Surrounding workplace activities are not suitable, discouraging staff remunerations and inadequate consumables for health workers to work with, as well as unequal treatment within the sector by the government and other socio-economic conditions in the country have resulted to this. We appeal that urgent steps should be taken to rectify the situation.
The health workers want the president-elect to review selection of ministers and chief executives in the health sector to mitigate the challenges confronting the sector.
Council observes with dismay the rising trend of Nigerians across the country, lamenting the untold hardship in the land, failure of government to genuinely tackle the myriad of difficulties and deprivation that the citizens are suffering from, which could inflict dire consequences on the country in no time. Council calls for urgent measures by the government at all levels to mitigate their suffering, which they said was becoming intolerable.
While commending the federal and some state governments for the payment of new hazard allowance to health workers, the unions called for the implementation of September 2017 agreement on adjustment of consolidated health salary structure, implementation of Pension Reform Act, as well as accommodating health workers in the National Housing Fund. Rafiu Hamid, TVC News, Ile-Ife, Osun State.